Acute otitis media is an infection of the middle ear which communicates with the throat and is important in a febrile child to look for it and treat it. Untreated or poorly managed cases may lead to complications such as mastoiditis, chronic otitis media, deafness, meningitis, and brain abscess. Precursors to the bacterial infections are viral upper respiratory tract infections. The causes are Haemophilus influenza, hemolytic streptococcus pneumonia, and Staphylococcus aureus. The symptoms are fever, sudden and persistent ear ache, purulent discharge from the ear, vomiting, diarrhea, crying, and agitation, impaired hearing. The signs that are usually elicited are red eardrum, discharging ear, occasionally inflamed throat, and perforated eardrum. Investigations: FBC, ear swab for culture and sensitivity. The main treatment objectives are to relieve symptoms, to ensure prompt and adequate antibiotic therapy, to prevent chronicity and other complications. Non-pharmacological treatment: adequate hydration, surgical repair and drainage of abscess. For pharmacological treatment, first-line treatment, for pain relief, we give paracetamol oral 500 milligrams 1 gram 6 to 8 hourly. In children 6 to 12 years, give 250 to 500 milligrams 6 to 8 hourly. 1 to 5 years, give 120 to 250 milligrams 6 to 8 hourly. 3 months to 1 year, you give 60 to 120 milligrams 6 to 8 hourly. For the treatment of infection, first-line treatment, we give amoxicillin oral in adults 500 milligrams 8 hourly for 10 days. In children 6 to 12 years, give 250 milligrams 8 hourly for 10 days. And 1 to 5 years, give 125 milligrams 8 hourly for 10 days. Less than 1 year, you give 62.5 milligrams 8 hourly for 10 days. Or amoxicillin clavulanic acid oral in adults 1 gram 12 hourly for 7 days. In children more than 12 years, give 1 to 5 milligrams tablets 12 hourly for 10 days. And 6 to 12 years, give 5 milliliters of 457 milligrams suspension 12 hourly for 10 days. 1 to 6 years, give 5 milliliters of 228.5 milligrams suspension 12 hourly for 10 days. 1 month to 1 year, you give 2.5 milliliters of 228.5 milligrams suspension 12 hourly. Dose doubled in severe infection. And 2 weeks to 1 month, you give 1.25 milliliters of 228.5 milligrams suspension 12 hourly. The dose doubled in severe infections. The second line treatment, give cefuroxime oral in adults 250 milligrams 12 hourly for 5 days. In children 125 milligrams 12 hourly for 5 days. For treatment of infection in patients with penicillin allergy, you give erythromycin oral in adults 250 to 500 milligrams 6 hourly for 10 days. And in children 2 to 8 years, give 250 milligrams 6 hourly for 10 days. And 1 month to 2 years, give 125 milligrams 6 hourly for 10 days. Neonates, give 12.5 milligrams per kilogram 6 hourly. Or you give azithromycin oral in adults 500 milligrams once daily for 5 days. In children 10 milligrams per kilogram once daily for 5 days. Referral criteria: to refer patient to ENT specialist if there is no response after 10 days of treatment.